Hello, my name is Dr. Ilya and I'm a dentist in Valencia. I also have an office in Simi Valley, Agoura, and Santa Barbara. And today I would like to talk to everybody about gum disease. One of the common questions I get, or actually when I ask my patients, so let me ask you a question. When was the last time you had your teeth cleaned? Oh, it's been 3 years, doctor. Well, how are you feeling? I'm feeling great. I have no problems with my teeth. We'll ask them, so let me ask you this. Do your gums bleed occasionally? Yes, occasionally, but it's no big deal. Well, that is actually a big deal. It is almost like comparing when somebody brushes their hair and they brush their hair and their scalp starts to bleed. Well, that never bleeds when you brush your hair, but when you start flossing, you bleed. Isn't that something wrong with your gums, you feel? And it is. In fact, when the gums bleed, it is a sign of infection. Ladies and gentlemen, it's a very big problem. That infection starts because there's bacteria in your mouth that sits there, multiplies, causes an inflammatory process, an inflammation, which later this bacteria also travels with saliva into your bloodstream and causes low-grade inflammation, which causes other problems for your body, such as you can feel tired, you can feel sometimes extremely sick, and you don't know where it's coming from, but it is your gums. And that is something that we need to really be careful about. So what we as dentists always try to do, and we talk to our patients, and we ask them, come in more regular, and people say, well, no, it doesn't hurt me, I don't have any problems, there is no problem with my mouth. Well, but you know what? There may be. So my advice to my patients, and the way I take care of the people that come to me regularly, is I have them on a protocol. Some people who have cleaner mouth, we bring them in every 6 months and do regular cleanings. Some people have a little bit more of a problem, such as they have more plaque or they build up plaque a little bit quicker, and everybody says to me, well, you know, I get this plaque, I get this white stuff behind my teeth. And behind their teeth, that's tartar. And so those people who build up a little bit quicker, we bring them in a little bit more often, every 4 months. Some people come in and they say, you know, I've got bad breath in my mouth, and my daughter or my child or my wife is complaining that she doesn't want to kiss me. Well, that's because the bacteria sits below the gum line and it causes, basically, it defecates in your mouth. And that's a problem. Unfortunately, that's what causes the fetid odor, and that's what causes the inflammation, the bleeding, the bacteria to be displaced to your mouth and through your body. So regular checkups, along with regular gum treatments and being on a proper protocol of gum treatments to treat this disease can prevent these problems from happening. Now, if you are doing this, that's great. But let me tell you the 3 different stages and the consequences if you don't do it. Well, if you're coming regularly and we're doing regular cleanings, not a problem. You're going to be maintained, your gums are going to be clean, your bacteria is going to be controlled. If, on the other hand, you don't come in for a long extended period of time and we check and we find out that your gums are very inflamed, sometimes we can get away with doing a more advanced cleaning, which is called a debridement. Now, this cleaning is not the worst cleaning, but it's a little bit more advanced than a regular cleaning that you can do if you're just doing regular checkups and regular cleanings. Now, if you haven't been for a while and your gums are in really bad shape, sometimes we have to do what's called a deep scaling. Deep scaling will then require us to give you shots and injections, but it's still something that we can do and get your gums back under control. But if you really are in bad shape, your gums can get very infected, and then the deep scaling may not be able to help you. At that point, you have to see a gum specialist, and the gum specialist may have to cut your gums, and that is something that I don't even want to talk to you about how bad that could be. So we want to try to avoid that as much as we can, and what we want to try to do is come in regularly and get our checkups and regular cleanings done. If you want to know more, you're welcome to go to my website or you're welcome to call my number and I will tell you more, and there'll be some more educational videos that you can see and I can give you some more information. It was nice to talk to you today.